this video, I am going to explain you what is diabetes mellitus. As we all know, insulin regulate glucose concentration in our blood. Okay, if there will be high glucose concentration in blood, this insulin regulate and to lower down the glucose concentration. Okay. So before going in detail, we should know first what are the causes of this diabetes mellitus. There are two types of diabetes, type 1 and type 2. Okay. Type 1 diabetes, what exactly happen? This is due to polymorphism of HLA, DR3 and DR4. Okay, this is genetically defective. Okay, what is the cause? Type 1 polymorphism of HLA, DR3 and DR4, and some diseases are associated with this, like Hashimoto's. If there is this disease, obviously it create this diabetes type 1. Hashimoto's, lupus and celiacs. Okay. What is type 2 diabetes? I will show you. Type 2 diabetes is causes to the people who have any metabolic syndrome. Okay. What type of metabolic syndrome? First thing, if the people have high waist expanded, it means there is high BMI level. If there is high BMI level, there is risk of producing this type 2 mellitus diabetes. Okay. Second thing, if there is hypertension, if people suffering from hypertension, they have risk of producing this diabetes mellitus. Okay. Third thing, impaired glucose uptake. Okay, if anyhow, if your body cannot uptake glucose level from your blood, then obviously it cannot utilize to produce energy or to store energy. So as a result, it may produce diabetes mellitus. Next we will discuss pathophysiology of this type 1 and type 2 diabetes. Okay, in type 1 diabetes, what exactly happen, guys? Our plasma cells, okay, let's suppose this is your plasma cell. Okay, what they produce antibodies, but the problem what happens, these antibodies are acting on cell. Which cell? I will tell you. This is your pancreas. Okay, in pancreas there is islets of Langerhans which produce insulin. Beta cell, what they produce? Insulin. So this plasma cell, they produce antibody against this beta cell, and because of this they destroy beta cell. What happened because of this? There is low insulin or no insulin. Okay, if in your body there will be no production of insulin or low production of insulin, what will happen, guys? Obviously, cells which are depend on insulin for glucose uptake, it will not happen. Okay, so the cells which are cells, muscle cells, adipose tissues, these are cells which are depend on insulin for taking up glucose. Okay, for what? To produce energy, to store energy. But if in your body there will be no insulin, this this process will halt and there will be no glucose uptake. Okay, so this is the case what happened exactly in type 1 diabetes. So in this case, patient may have to take uh, insulin injections, okay, because there is no other way. This is because of genetic, guys. Okay, later, guys, as we all know, in our blood high glucose and no insulin. This is the case in type 1. Okay, what will happen next in our body in such a condition? First thing, our kidney, they become loaded with the high glucose concentration because they try to reabsorb more glucose. Okay, but as they cannot do, they put up all the glucose in your urine. Because of that, there is polyuria condition occurs. Polyuria, and because of this polyuria, our body they produce the condition which we call polyphagia. Sorry guys, it's not polyphagia. A minute. Because of this polyuria, our body required more drinking water because we we feel more thirst, and that condition we call polydipsia. Okay, polydipsia. Okay, this is one condition. Second condition, what happened, guys? As our body can't take glucose for energy, they try to metabolize energy from other sources like lipids, proteins. Okay. So because of the high lipid breakdown, it causes lipolysis, then high protein use for the energy, so it becomes, that condition becomes proteolysis. And because of this whole high metabolism condition develop, we call polyphagia. Okay, because of this high metabolism, guys, this high lipogenesis, lipolysis, high proteolysis, the condition develop, we call polyphagia. Okay, so all these things happen in the type 1 diabetes. Okay, now next, what is type 2 pathophysiology of diabetes mellitus? Okay guys, in this case, insulin secreted in our body, but what exactly happened? The cells have the receptors which react to this insulin. They becomes resistant to this insulin. As a result, what happens? When the receptor comes and binds to this receptors, they cannot stimulate properly to these receptors, and because of which, what happen? Again, there is low uptake of glucose to this cell. Okay, and as a result, again, what happen? There is high glucose in blood. Okay guys, are you understanding? In this case, insulin is producing, but the receptors become resistant to your insulin, and because of that, again the cell cannot uptake glucose, and as a result, what happen? Again, your blood glucose concentration picks up. Okay, again the same condition happens. Again, your kidneys load become more. They try to take more glucose absorb, and they cannot. If they cannot take, obviously they excrete it in urine, and the condition becomes polyuria. And because of this polyuria, person feel more thirsty, and that condition we call polydipsia. Okay, and then again the condition one more becomes what? Polyphagia. Why? Because body try to uh, excrete energy from other sources like lipids and proteins, and because of this high lipolysis, high proteolysis, patient feels more metabolism of other sources, and that condition becomes polyphagia. In this case also, patients may feel weight loss. Okay, now this is the one case. And what happens second case? In this case, as insulin is more, with the insulin there is C peptide, and amylin also produces in body. If there is uh, more insulin but resistant to your body, obviously there is more glucose, and because of this more glucose, this high glucose, this stimulate your pancreas to produce more insulin. So because of this high insulin production, obviously amylin production also becomes high, and because of this there is amyloid deposition in beta cells, and because of this amyloid deposition, it leads to destruction of your beta cells. As a result, again, as beta cells are destructed, obviously then initially initially your insulin were high in concentration, it decreases because of this amyloid deposition. Then in type 1 type 2 condition, what happened guys? Initially insulin level becomes high, but later as it progress the disease, your insulin level goes down. Okay, and because of this again there is high glucose concentration, because cell cannot take your glucose for energy or to store energy. Okay,